Hello Perfect Beauties, my name is Daisy and today I'm going to be talking what a UTI is and common symptoms of UTI, the causes, as well as preventing a UTI for today's TMI Tuesdays, where I cover a topic that you guys want to know but are too afraid to ask. So a UTI is an infection which involves the urethra where you pee, the bladder, and the kidneys. Mild urinary tract infections are located by the urethra and bladder, and then when the infection starts moving up your kidneys, then it becomes serious. Urinary tract infections are actually extremely common, and it's the second most common infection next to respiratory infections. So did you know that girls tend to get UTIs more often than guys because girls have a shorter urethra than guys, so bacteria has a shorter distance to travel up to the bladder. So if you have any of these symptoms, then you should see a doctor as soon as you can for a possible UTIs. So what are the symptoms? Symptoms for a UTI include 1. Burning or pain during urination. 2. Feeling the need to pee a lot without actually having to pee. 3. Cloudy or bad smelling pee. 4. A feeling of pressure where your bladder is or pain. 5. A mild fever between 99 to 100 degrees, but some people, most of them, don't actually have a fever. Usually a UTI will start off with those symptoms, but sometimes the infection can spread to the kidneys, and if you have a kidney infection, then the symptoms may include higher fever, chills, nausea, vomiting, pain near your back or side where your kidneys are located. If you notice any one of these upper urinary tract infection symptoms, go to a doctor that same day or visit an ER or urgent care center because kidney infections should be taken very, very seriously. So most healthy people won't get a kidney infection, but just in case, I want you guys to be able to recognize the sign. So why do we get UTIs? Why are they so common? So UTIs are caused by the bacteria E. coli, and that bacteria is found around the butt. But if that bacteria travels to where you pee, then it can move up the urethra and cause an infection. Poor hygiene or intercourse are the main causes of UTIs, and the bacteria causes an infection once it moves up the urethra and settles into the bladder. UTIs can be diagnosed with a urine test at your doctor's office or at a hospital, and the treatment for it is usually an antibiotic that will be able to kill off the E. coli bacteria in your body. During treatment, listen to your doctor's directions and drink lots and lots of water during the treatment. So next, I will give you tips to stop getting UTIs. So tips from preventing UTIs. Always wipe, girls, you know what I'm talking about. Wipe from front to back to avoid bringing the butt bacteria towards your urethra. Second is if you are sexually active, go to the bathroom and pee shortly after sex to help flush out any bacteria in your urethra so it doesn't get in there. 3. Spermicides or diaphragm methods of birth control increase your chances of getting UTI, so consider other possible birth control methods. 4. Some doctors recommend taking an antibiotic after sex if you are prone to getting UTIs, but a study showed that taking at least 500 milligrams of cranberry extract was just as effective as the antibiotic dose. Also, antibiotics are not the greatest thing for you in the long run because they can also cause yeast infections, which I will be talking about in another TMI Tuesday, so stay tuned for that. Or it can cause resistant bacteria strains. So if cranberry works for you, I might as well suggest you stick with cranberry. And you can also drink pure cranberry juice or the sweetened juice cocktail stuff at your local grocery store. So probably Thanksgiving is a great time for preventing UTIs. Did you know cranberries can help prevent UTIs because they keep E. coli from sticking to the walls of your bladder? 5 is don't hold in your pee and drink in plenty of water. Holding in your pee gives your bacteria more time to multiply. So thank you all so much for watching. That is all for this week's episode of TMI Tuesdays, where I talk about a subject that you guys want to know but are too afraid to ask. And stay tuned because I also have a TMI Tuesday on yeast infections. And also don't forget in the comments below to write down any other topics you guys want me to talk about for next week's TMI Tuesdays. I've gotten topics on how to lighten dark underarms, bedazzle vaginas, UTIs, STDs, pubic hair waxing, anything and everything you want to talk about. I am #shameless. So thank you all so much, and I'll talk to you guys later. Bye. Want me to talk about bedazzled vaginas, and I've never heard of this before, but decided to look into it, and here we go.